And I'm
Hello
looking at
and
the
welcome
camera.
to another episode of Local Expert Interviews. My name's Michael Grady, and today we're going to be speaking to Dr. Leslie Sims of the Sims Center in Las Vegas, Nevada. Dr. Sims is a board-certified Las Vegas ophthalmologist. Dr. Sims has been named one of the top doctors in Las Vegas by Desert Companion magazine. Dr. Sims provides quality and innovative reconstructive and aesthetic surgical and non-surgical procedures of the eyelids and surrounding facial features. Welcome, Dr. Sims.
Hello. How are you?
Fantastic. Dr. Sims, please tell our viewers a little bit about yourself and your practice in Las Vegas.
As you mentioned, I am a board-certified ophthalmologist and a fellowship-trained oculoplastic surgeon. I moved here from New York about 3.5 years ago. I was in a practice and decided to open up my own practice, and our doors have been open since January 2013. Our practice is a combination of functional and aesthetic oculoplastic surgery and non-surgical procedures. The functional procedures include anything from ptosis repair, which is the droopy eyelid, to malpositioned eyelids such as entropion and ectropion, tearing disorders, basal cancer of the eyelids, etc. The aesthetic piece of the practice deals with the injectables such as Juvederm, Restylane, Radius, of course Botox, Dysport, and Xeomin. We also have a microneedling device which is great for fine lines and wrinkles, keloids, scars, stretch marks, and as well as PRP for rejuvenation of the skin, improving its tone and texture.
That's a lot of different things that you do, and I know you just mentioned PRP, which of course is platelet-rich plasma. So can you talk to our viewers a little bit about what exactly is platelet-rich plasma or PRP therapy?
Well, it's been around for a while. It's been used in other disciplines in medicine, such as orthopedics and dentistry. The idea behind it is that you use your own blood, which has a number of growth factors, which can be used to help rejuvenate the collagen and the skin itself, the epidermis, and it's removed from the patient and then activated, and then returned back into the patient either by putting it on the face. I would say for our purposes, putting it on the face after the microneedling is done, or injected into the face. It's great properties when it comes to the growth factors. Again, it promotes angiogenesis, is among one of the major things that it does, and that's very important when it comes to rejuvenating the skin and improving collagen formation.
Dr. Sims, I know that facials are a very popular procedure. Can you talk to our viewers a little bit about what exactly is a PRP facial?
A PRP facial would be a procedure where we would first use the microneedling device, and that serves to create, for lack of a better term, holes in the skin, much like a Fraxel laser, but without the heat. And once the Dermapen treatment is complete, you can take the PRP and actually just rub it onto the face, and it will soak into the skin. It's much like what they do with golf courses when they reseed a golf course. So it's kind of the same principle.
Well, you mentioned the Dermapen. What exactly is a Dermapen, and how does it work?
Dermapen is a trademark name for a microneedling device. It's automated. It does not deliver heat, such as a Fraxel does, but it does a similar thing as Fraxel in terms of delivering controlled trauma to the dermis of the skin. And what that serves to do is recruit collagen formation, which helps with the tone texture of the skin. As we age, we lose our collagen and elastin, and that's why we get the issues with the sagging of the skin, loose skin, and what we're trying to do is tighten the skin.
So in tightening the skin, I imagine that treats wrinkles, stretch marks, and acne, that sort of thing, correct?
Correct.
So how exactly does a Dermapen treat wrinkles and stretch marks and acne?
Again, by applying with their fine needles attached to the automated handpiece, and again, it delivers controlled trauma to the skin and the epidermis and the dermis of the skin. It's minimal trauma to the epidermis, which is good, but where the action really occurs is in the dermis.
So if someone came in and they wanted to have a PRP facial using the Dermapen, how long is it after the procedure before a patient sees results?
Actually, they see the results immediately. They'll notice that the skin is a lot brighter. It may be a little bit rosy, even a slight sunburn, but that's from the Dermapen. But most patients do say that they notice an immediate difference, and I should say improvement, as well as the fact that this transformation occurs over a period of 3 to 4 months. So they're continually seeing improvement.
Now, let me ask you, like you said, the Dermapen is controlled trauma to the skin. So I guess the next question that I think I would have, or our viewers would have, would be, what does a Dermapen treatment feel like?
I've actually had one, and it's fairly comfortable. We do put an anesthetic topical medication on the face prior to the procedure, and it's actually a pretty comfortable procedure.
Well, let's say that one of our viewers would like to get more information about a Dermapen or the PRP facial treatment. Are you available to answer questions?
Absolutely.
Is there anything else you can tell our viewers about the Dermapen or the PRP procedure?
Well, I think it's a procedure that is well tolerated by all skin types, which is unlike a laser. Patients do see a benefit with it, and also it's been around for a long time. It's actually been called the poor man's Fraxel because it doesn't require the outlay of resources to use the machine. I think patients generally like it. You can be used at a younger age, and it can be done over several treatments, and patients will see a benefit that lasts up to a year, year and a half.
Well, let me ask you then, if someone was looking to have this type of procedure done to get rid of wrinkles or stretch marks, of course acne, which is a big problem, who exactly is the best candidate for this procedure?
Everyone. That's the beauty of the Dermapen. They're all skin types, and so the darker skin patient can also be treated just like the lighter skin patient.
That's fantastic. Dr. Sims, I think you've given our viewers a lot of great information here about having a facial procedure that many people probably don't even know is out there.
Well, thank you.
If any of our viewers would like to get more information from Dr. Sims about the Dermapen or the PRP facial procedure, you can always refer to the phone number at the end of the video. Again, Dr. Sims, thank you so much for doing this interview and providing all this great information.
Well, I'd like to stress also that we do other procedures. We have a skincare line also, which is actually a good adjunct to the Dermapen, as well as we do aesthetic surgical procedures such as eyelid lifts and the baggy eyelids, etc. So everyone feel free to call, and we will let you know the array of services that we can provide for you.
Fantastic, and if any of our viewers would like to get more information about those other procedures, we do have other videos available.
Okay.
Again, my name is Michael Grady. This has been another episode of Local Expert Interviews. We've been speaking to Dr. Leslie Sims of the Sims Center in Las Vegas, Nevada. Dr. Sims, thank you so much.
Thank you.